So what does an optimal program look like? So I've just given some good basic options to look at. So if we have a beginner starting with no disease diagnosis, they're just a beginner, they don't have insulin resistance, no issues on their CIMT scores, it's going to be a little bit different than a beginner that had plaque and has insulin resistance present. And so we're going to take a look at how a program might look differently for each of those individuals. So resistance training, cardio training, and then also a little formula at the bottom. So resistance work, we're shooting for at least 2 days a week for this beginner. We're going to do 1 to 2 sets of 12 to 15 repetitions and do anywhere from 6 to 8 exercises, working all the major muscle groups of the body. So fairly basic, again, just 2 days a week. We want to intersperse some cardiovascular work, 3 up to 5 days per week, goal of 120 to 150 minutes time training at a moderate intensity. So I have set a 65 to 75% threshold of your max heart rate. So there's a handy formula if you're not familiar with how to calculate heart rate zones. Many of you are, but several may not be. So max heart rate is determined by taking the number 220 and you subtract your age from it. That gives you what's called your age predicted maximum heart rate. So that gives you your max level that you should ever push towards. Then we take our percent of 65 to 75%, multiply it to that max number, and that gives you your training zone. So for this beginner, we can go through that process and identify what their heart rate zone should look like. The beginner now with those issues from a health standpoint, a little bit different format on resistance training. We're not just working at a just moderate dose, we're going to try and build some intensity through doing what's called circuit training. Circuit training, if you're not familiar, is moving from one exercise to the next with minimal recovery in between. That boosts the heart rate response, it boosts the breathing response so that you're getting cardiovascular conditioning at the same time that you're building some strength and stamina in the muscles. So the byproduct of that is you get a great dose of helping improve both attributes that are important to reverse insulin resistance, as well as to help minimize the plaque deposits and help begin to pull those deposits out, give that healthy boost to our HDL cholesterol and help minimize the LDL. So circuit format of resistance work versus just a standard, do an exercise, rest, do that exercise the second time and rest. So that's the difference on a resistance standpoint. The other aspect from a cardiac conditioning, we're going to get into some interval work, at least 2 days a week, 15 to 20 total minutes of time on the intervals, and we would have 6 30-second bursts of a higher level of intensity, followed by 6 recovery bursts of movement. So what that might look like, say, from a bicycle, if you chose the stationary bike for your interval tool. You would push yourself at a fairly moderate pace for your 90-second window, very low if any resistance, just a moderate cadence just to get some motion. On your 30-second burst of higher intensity, you could do one of 2 things. You could just add resistance to the pedal stroke and maintain the same cadence. You could just boost the cadence alone, no resistance, or you could do a combination of those 2 factors, add resistance and pace, and go for that 30-second burst. Then you'd pull it back to that low level for 90 seconds, and then rinse and repeat, so to speak, take that shampoo type of a format to it and do that 6 times and accumulate some intervals. Because again, intensity is really the key for reversing insulin resistance and to help get that arterial age to be decreased more quickly. We also want some standard cardio training as well. So we can't go all out all the time, keeping in mind recovery principles that I just spoke about. We want to have some lower level intensity. It's going to be slightly higher than that person that had no disease status. You can see the difference on their numbers, 65 to 75 versus 70 to 80%. So it is a slightly higher intensity for those steady state cardio workouts. Make sense? All right.